The European Union has hit out at pharmaceutical giant AstraZeneca over a 60% drop in the supply of its COVID-19 vaccine to the bloc. The British-Swedish company blames a production fault for the delay, but Brussels is threatening to stop exports of the inoculation unless the issue is resolved. The EU has already paid €336 million to secure 300 million doses.
The answers of the company have not been satisfactory so far. The European Union wants the ordered and pre-financed doses to be delivered as soon as possible. And we want our contract to be fully fulfilled. In addition, the Commission has today proposed to the 27 member states in the steering board that an export transparency mechanism will be put in place as soon as possible.
Over in Strasbourg, the local deputy mayor says a vaccination centre is already at a standstill because of a lack of doses, despite strong demand.
So we have a potential of 2,300 people to be vaccinated per week here in the centre of Salle de la Bourse Hall in Strasbourg, and we're going to drop to 1,500. We have to adapt the doses each time with the appointments, move people around, spread out the appointments, whereas we could do many more vaccinations. So there's a feeling of frustration, a very strong demand for organisation that's present, reliable, but cannot go to full capacity because there's a lack of vaccines.
Meanwhile, US drug maker Moderna says its COVID-19 vaccine appears to work against the UK variant. However, it's less effective against the one that has emerged in South Africa. The company says it's developing a new booster dose to target the new variant from the Southern Hemisphere, which will be available from the autumn. Louise Miner, Euronews.
Let's find out more. We can head to Brussels to speak to our correspondent there, Shona Murray. Shona, when the Health Commissioner says the EU will take any action required to protect its citizens, what options is she looking at?
Well, certainly, Rosie, we heard there it is implied that the EU may resort to blocking the exportation of vaccines produced in the EU to third countries unless the EU gets, the vaccines, the doses that it paid for. But that's certainly just something that's implied. It's not what the EU has said. The EU has said that it wants transparency in relation to doses that are made, produced in Europe, and also where they're going. But certainly that could be the end game. But I'm joined now by Billy Kelleher, Irish MEP, who's been discussing this for some time now. Billy, what's happening with AstraZeneca? I mean, we don't have any answers. We know that the meeting with AstraZeneca yesterday went badly. We don't know why they've decided that 60% of the supply is not available to the EU, but the UK, for example, gets its supply.
Yes, we have to find out definitively whether AstraZeneca is fulfilling its contractual obligations to the European Union. Bear in mind, all the European Union wants is to ensure that companies fulfil their contractual obligations in an impartial way. In other words, they're not prioritising other countries for any other reasons. So we need to ensure that it is at capacity, it is able to produce the vaccines it said it would be able to produce, and we wait for the approval then from the EMA, hopefully on Friday, and that then should allow at least a rollout. But in the meantime, if AstraZeneca is providing vaccines outside of the contractual arrangement to the European Union first, well, then that's an issue of grave concern, and it has to be addressed immediately. We have to have integrity and transparency in the vaccination programme of the European Union, and that means all companies, in my view, should outline definitively the contracts, their obligations and their supply chains.
Is it possible, do you think it will get to that the EU could actually block the exportation of vaccines outside the EU to third countries? I mean, that would be hugely dramatic action, wouldn't it?
It would be dramatic action, but at the same time, the European Commission, along with all the member states of the European Union, have an obligation to their citizens as well. And they have to ensure that, at the very least, we are getting our fair pro rata basis of supply of vaccines as to the other countries who have done contracts with these companies as well.